Rolling or twisting your ankle couldn't be a more common injury. I'm sure it's happened to you at some point. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. It's important to identify how severe your ankle sprain is so you can treat it appropriately. In today's video, I'm going to discuss how to determine how severe your sprained ankle is, when you can treat it at home, and when you need to come into the office for more advanced treatment. Before I do, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. When you roll your ankle, most of the time it's an inversion ankle sprain. This is when you twist and the sole of your foot is facing your other leg. This damages the ligaments on the outside of your ankle. There are 3 ligaments, and the severity of the ankle sprain has to do with the number and extent of the damage to these ligaments. The damage may be to one or more of the ligaments that help to support your ankle. There are 3 stages for an ankle sprain. Stage 1 is a mild injury. This is when the ligaments stretch and may have a small tear. There'll be some mild swelling and some tenderness to the outside of the ankle. Stage 2 is a moderate injury. It involves a partial tear or one or more of the ligaments. You'll have increased swelling. It will be painful to move your ankle. Stage 3 is a severe injury. There is a complete tear of one or more of these ligaments. There is substantial swelling and bruising around the injured area. It is painful and walking is very difficult. The treatment that you need for a twisted ankle depends on the stage of the injury. For a stage 1 injury, you should ice your ankle for a couple of days, no more than 20 minutes at each time. You should be good to go in about a week. It wouldn't be a bad idea to protect your ankle with an ankle brace for a couple of weeks after the injury. For a stage 2 injury, you should rest your ankle and ice it for a couple times a day for 5 to 7 days. It's also important to protect your ankle by supporting it with a good ankle brace. I like the ankle braces that lace up and use Velcro straps to lock the ankle. You should wear the brace for about 4 weeks after the injury. A stage 3 injury is the most serious. Truthfully, if you see bruising, you should come into the office for an x-ray to make sure there's no damage to the bones of your ankle or foot. You need to rest and ice your ankle for at least 2 weeks after the injury. Then you'll need to protect your ankle for 4 to 6 weeks after the injury. First, you're likely to be in a walking boot for a couple of weeks. Then we'll move you to an ankle brace. If you look online, you'll see a lot of talk about early mobilization for ankle sprains. I can't stress the importance of resting the injury. It takes time for ligaments to heal. Early mobilization will slow the healing of the ligaments, and when they do heal, they'll heal in a stretched position. This will lead to ongoing instability in your ankle. In terms of medication, taking anti-inflammatories can help reduce the pain and swelling. It doesn't speed up the healing times, but it will make you feel more comfortable, and there's a lot to be said for that. Let's talk a little more about the right ankle brace to get. Slip-on ankle braces and gel sleeves do not offer the protection and support that your ankle needs. You need a bulkier brace that provides proper protection. Yes, it may limit the shoes you can wear, but it's a short-term inconvenience for a long-term benefit. The brace should have laces or Velcro straps or a combination of both. The brace is important because it will prevent the motion that caused the injury in the first place. The brace is going to allow you to walk more comfortably without fear of re-injuring your ankle. There are also some physical therapy exercises you can do at home. Don't start the exercises until after the resting period for the injury. That's 1 week for stage 1, 2 weeks for stage 2, and 6 weeks for stage 3. At that point, you want to start strengthening your ankle. Good exercises to strengthen your ankle is to do toe raises. You can also twist your ankle back and forth with light resistance bands, and you can mobilize your ankle by tracing the alphabet with your big toe. Another helpful exercise is to stand on one foot for 1 minute and try to stop yourself from wobbling. Make sure you're next to something you can hold on to so you don't fall over. For a stage 3 injury, I may send you to a physical therapist for strengthening exercises. The takeaway for an ankle sprain is that you need the ligaments to heal. You need to immobilize the ankle to facilitate the healing. You may read about tricks to speed up the healing, but it just takes time for these ligaments to heal. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you've sprained your ankle and you feel like it needs attention, especially if it's difficult to walk and you see bruising, come in for a visit and let's see if we can get you relief. That link is in the description. Thanks so much for watching and have a great day.